Okay, Jeffrey Hauser here. I wanted to do a my own voiceover commentary on what was happening in surgery. It's 12 days after surgery, so I'm going from memory. And it's really weird to watch this, I can honestly say. So first off, I believe they are taping, or they will start out by taping back my eyelashes. And then they put like a metal clamp in there to keep my eyes open. You see the metal clamp on better on the second eye than you do the first eye. At this time, they had me holding a stuffed bear. They called him Seymour, which was a joke, a bit of a joke anyway. So, and that was, Dr. Gold said that was so my hands would not help him. And let's see, I've already been numbed. They brought me in, like did some recheck of some calculations, and then they put plugs in my eyes. So they had already put plugs in my eyes. And that's, I believe that's plugging up the lower tear ducts so tears do not leak out of my eyes. So it's easy, so my eyes will naturally stay more hydrated, because this type of surgery can harm your ability to generate tears on your own in the short term. Long term, they should sort of fix themselves as the eyes heal up. Okay, not sure what's going on here. So that maybe that was just a calibration or something. So they are. It looks like you just put drops in my eyes, and that is probably they just taped back my eyelashes. And then now they're putting the clamp to keep my eyes open so my eyes don't close during the procedure. You can see I'm looking up. I see there's the circle of light right above me, which you can see actually in the center of my eye. And then there's two lights which are actually below me. I don't know if that means this image is flipped or not. So they told me this would be on for 60 seconds. Basically, I'm basically blind as they put this on. And I don't know what this is. The whole time they're actually talking to me about cameras because they knew I had my wife bring in a camera. Dr. Gold does like underwater photography, which just sounds phenomenal and fantastic and awesome. And so, they were just naturals at keeping the conversation going and trying to basically avoid me thinking about what they're actually doing. I've been previously numbed up, so I'm not really feeling anything. Yeah, so this initial thing is on for 6 seconds. I assume this is some type of alcohol pad or pad soaked with alcohol or something that is basically loosening or breaking down the top sort of covering of my eye. And of course, all this is my perception, which is not necessarily medically what's happening. So always take that with a grain of salt and talk to your doctor if you have questions. Don't get any medical advice from videos on the internet. And now there's more liquid going into my eyes. And then they start, it's almost, they described it to me like a toothbrush. And you can actually see, it'll start shortly, they're taking they're rubbing my eyes and taking the top layer off. It's kind of creepy. This video kind of actually creeps me out more than I thought it would. And I'm so glad I didn't see it. There's that toothbrush thing. My eyes are a beautiful green color, if I don't say so myself. Yeah, so it's weird just to see all the gunk they're scraping off my eye, which of course I'm assuming is part of my eye and is clearing the cornea for laser. I'm happy the surgery was short because I wouldn't call it the most comfortable situation in my life. When I first walked into the office, and they were checking me in, Dr. Gold was there in his surgery scrubs, I guess I would call them, and said they were doing an awesome job today and moving along efficiently and effectively. So that was great to hear. And I assume it was true as opposed to just trying to make me feel like to calm my nerves, but it worked in both cases. That almost looks like a different tool. Or perhaps that tool was there before. So now it's probably lining up. And this is, they're doing the right eye, which is my more blurry eye. So, and this was the one they operated on longer, I think I think it was 28 seconds. We could probably time it on this video if we want. You'll notice primarily the laser, this whole, see, this is probably where it starts. Roughly, yeah. I'm trying to follow the time count. And you notice primarily this big outline that's over my eye is, and then they're probably done. Fit into the space they screwed out. And this was on my eye for a lot more short of a time. So not the 60 seconds originally. And then they take it off. And I think for 1 second I had amazingly clear. And then they put on this water. This is super cold water, and this was really uncomfortable. I could actually feel it in the temple, in my temple, my right temple, giving me a headache as they did it. So that was super uncomfortable. Dr. Gold said, it's not going to last long. I may have complained verbally, said not going to last long. They do it to help sort of numb the nerve endings, which I assume is what they just sort of scraped away. And of course this is so they don't inflame. If it inflames, I have pain, and pain is bad. Slight discomfort, which you'll see a lot more of my update videos where I talk about this, such as like feeling like an eyelash in my eye. That's okay, that's normal, it's going to be a little uncomfortable. Do eye drops, that'll help minimize that. Now here, they're putting on the bandage contact lens, which is just a clear contact lens that protects the eye. I actually had to wear 2 of these. They had me back for 4 days after the surgery for an appointment. Took a look at my eyes, took out the bandage contact lens. Says, let's have you wear it and come back in another 4 days. So I formally got them out a week after the surgery, or a Friday appointment. I got them out on the next Friday. Now it looks like they took out the clasps that were keeping my eye open, and they removed the things that were taping back my eyelashes. And now they're moving on to the next eye. And they're going to do the same procedure all again. This should be working on my left eye. And I felt the video, oh, there goes I felt the video was a lot better on the left eye. It was a lot more centered on the TV. So it looks like they already taped back the eyelashes. and they are putting in the clamps that keep my eye open. I recorded a video of this on the day after or the day of the procedure of me talking about my experience. So hopefully I'm equaling that. Once again, they put this on. They told me it would be on for 60 seconds. Okay, about halfway through this, I started to think, oh my God, what am I doing? And then they're putting some liquid on there for sure, which is not the super cold numbing drops. So I assume this is sort of something that helps loosen the eyelid to allow them to brush off that top layer. I believe there were actually 3 people in there. One person was operating the laser, or at least standing near the laser controls, and Dr. Gold was the one, or I believe Dr. Gold was the one actually performing this work on my eyes. And then there was a 3rd person in there. I'm not sure what she was doing. Probably assisting Dr. Gold, like handing him equipment or whatever, but don't hold me to that. Yes. This is definitely one of the creepier things I've ever had done to myself. Now, the actual laser correction on this eye was a lot shorter, like 12 seconds or something. And it looks like they're probably getting ready to start. And I think it starts when this goes solid. And everything turned gray. My eye turned gray anyway. a little weird to see it go dark. So one of the sort of legal, that 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 17, 19, 20, 21. And then it's got to be done. So that was, I don't know. If I counted that, that was 22 seconds. But if I was counting right, which I may not have been, I'm editing this. My eyes are still not where I would consider 100%, but they've definitely been improved. Yesterday was a better day than today. I saw a slight backslide today and some more double vision. Now they're putting in those cold drops, which on this eye gave me a headache in the temple on the left side of my head. And that was most likely the bandage contact lens I think they just put in. And it looks like they're probably taking out the taking out the metal, and then they're probably going to untape my eyelids. Almost done here. And that's pretty much it. Then I sit up, they tell me to look around the room, and that is good. And then we're done. They snapped a photo of me with Dr. Gold. I'll have to ask if I can get a copy of that.